morning. My name is Micheal and I'm one of the physical therapists here at Barkman & Smith Physical Therapy. Today I'm going to talk with you about how to manage acute injuries. Of course, everything said today is prefaced that if you feel you've been seriously hurt, please dial 911. And if you feel you have a significant injury, seek medical attention through your primary care doctor or an urgent care facility. An acute injury is something that just happened. And provided it's not severe enough for 911, we recommend utilizing the PRICE method. PRICE stands for Protect, Rest, Ice, Compress, and Elevate. Protect is referring to protecting yourself from further injury. This is achieved by avoiding painful activities and utilizing a splint or a rigid brace. Rest is referring to taking a few days of minimal use. Temporarily using crutches or a sling is one way to accomplish this, but the focus is to avoid causing yourself increased pain. Next is ice. When icing, you should apply it to the injury for 20 minutes and never directly on your skin. You want a thin barrier such as a towel or a pillowcase. And if you don't have ice, substitutions would be any store brand ice pack, Insta ice pack, or even some frozen vegetables such as frozen peas. Compression is best achieved with a light compression brace or an ACE wrap. But remember not to wrap it too tightly, as this can cause further damage. So rounding out the acronym is Elevate. Elevation is best achieved when the affected limb is above the heart. In the first few days, this can be done once an hour for about 20 minutes, and if possible, while icing. So the next time you find yourself having had too much fun for one day, remember to protect, rest, ice, compress, and elevate. I hope this was helpful, and for more information and videos, please refer to our website and social media. Make it a great day.